on your face when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
And we are back here on Youth Wednesdays on Tobago Updates. Dwayne and I, we promised you a vigorous and a vibrant interview session here this morning, and we are happy to introduce you to our first segment with Dr. Jannike Frank Edobor. Good morning to you, Doctor.
Good morning. Such a pleasure to be here today.
Good morning, good morning. Right, so as promised, based on what yesterday's theme of stroke awareness was, we are here to speak with Dr. Edobor about what a stroke is for those of you who may not know. What are the signs and symptoms we can look for, and etc., etc. Right? So, Dr. Edobor, what is a stroke? What is defined as a stroke?
Okay. So every organ in your body needs oxygen to survive. So a stroke occurs when there's a cutoff of the blood flow to the brain, leading to the death of cells in the brain. So there are different ways that that can happen. So one way is that a blood clot forms in the vessel, and that prevents blood from getting to the brain. And another way is where the vessel itself bursts, and that's the bleeding in the brain that we talk about, and that is a hemorrhagic stroke.
Okay, and who can suffer from a stroke? Are strokes partial to a certain age group, or can anyone suffer from a stroke?
So adults over the age of 25, 1 in 4 adults in their lifetime will have a stroke. It's more common in persons over the age of 55 as well. And there are other reasons for persons to have strokes. So there are many risk factors, some of which we can solve and some of which we can't. We just have to manage, such as your age and being female.
Okay.
So
All right.
what we
So,
do, go ahead.
oh, sorry about that. So in my short stint of being a Tobagonian, I've only been here just a short while. I have noticed that Tobagonians seem to have an uptick in the stroke patients. Is there any merit to that observation, and what can you say kind of count for this prevailing factor, relative to this discussion?
So definitely there has been a significant uptake in stroke. In the hospital, we manage between 20 to 30 stroke patients a month.
Wow.
When I was a junior doctor, it was in the teens, right? So we have more than doubled that number. And the reason for that is usually our lifestyle changes, lifestyle choices. So starting with the foods we eat, high salt foods, fatty foods, foods high in sugar, yeah, smoking 1 pack of cigarette per day increases your risk of having a stroke by 6 times. And don't talk, and what about alcohol? Alcohol consumption, excessive alcohol consumption. And then there are the lifestyle diseases that we know that you always hear us talking about comorbidities. So high blood pressure, which is the leading cause of having a stroke.
Right.
That's rampant on our island. And because there's no symptoms, people don't know they have high blood pressure. You actually have to have your blood pressure checked.
Right.
Diabetes, high cholesterol, obesity. These are the factors that are causing the increase in the uptake or in the incidence of stroke on the island and worldwide.
All right. And you mentioned earlier that a stroke is essentially is the lack of oxygen to a specific organ, namely the brain. Does strokes only happen in the brain? And if not, where else in the body can a stroke occur?
So the stroke that we're talking about today has to do with the central nervous system, particularly the brain. So the brain and the brain stem, those are the strokes that we're talking about. We can have stroke as it occurs to our spinal cord, but as a different entity. And then we have other nomenclature that we use, like heat stroke, that is a whole different ball game, right?
Okay. So what are the signs and symptoms of a stroke? Okay, God forbid, how do I know that I'm getting a stroke?
Remember the acronym FAST. FAST, right? Because time loss is brain lost. So FAST usually have weakness to one side of the face. So the face will be drooping or twisted to one side. A is for arm, so arm weakness. A lot of persons have like a cup drop out of their hands, or they realize they can't pick up a pen, etc. And then speech, the slurred speech or the inability to get the words out or speaking in confused sentences, and time. Now, I can't stress the importance of time, as in get to the hospital as soon as possible. The majority of persons, especially in Tobago, they watch it. They watch it. They will tell you that they're watching the symptoms. You need to get there early so that we can actually treat the stroke. And we have a narrow window with which we can actually treat. And I'm talking about ischemic strokes, the clots. It's only 3.5 to 4.5 hours. That is all that we have for you to reach, get assessed, get the image, get the report, and get treatment, right? So get there early. But there are other symptoms. So loss of coordination, loss of vision, headaches, confusion, loss of consciousness, seizures, and it could even get numbness and tingling. It just depends on which area of the brain is affected. But FAST is the acronym that you really need to remember to assess yourself and to assess anybody around you to know if they're having a stroke and to get to help and to get to help fast.
Right. So Dwayne, could you remember what FAST stands for? F is for
Yes, fist.
right. A is
Fist.
for arms. If your arms
I think I must be having
drooping.
a stroke.
Oh my goodness, no.
Oh, no.
All right. The S is for slurred. It's slurred
Slurred
speech,
speech.
right?
And
Right.
T is for
And T
time.
is for
What does
time.
E stands for?
The A stands for arm.
Very good.
Right.
Very good. You're learning. Very good.
Well, you got it wrong,
Yes.
so I had to. All right. So, viewers, we remember the acronym FAST in terms of the signs and symptoms. Now, I hear you mentioning, well, you mentioned heat stroke. That is one that we are more commonly known. That is more commonly known amongst the population, right? Everybody knows about heat stroke, right? Your parents could tell you, don't go in the fridge right after you come from outside, and whatever be the case. We'll get into that part, right? But could you tell us the types of stroke that a person can suffer from? So you mentioned ischemic. I heard heat stroke as well. So are there any other strokes?
Okay, the strokes we're talking about today are ischemic and hemorrhagic, right? Heat stroke is a totally different entity, just has the same ending name, right? But ischemic and hemorrhagic stroke. So think about it as you have a hose and you're watering your garden. So a ischemic stroke, the particles or the debris blocks the hose and there's no water getting to your garden, right? So basically a clot blocks off the blood flow to the brain. The other way is your hose, you twist, you turn it, the walls get weak, and then it bursts. So, and then the same thing happens, blood doesn't get to the target, right? And that is a hemorrhagic stroke. So one is a clot and one is a bleed.
Right.
Okay.
Wow. So I am getting a bit scared, thinking about this because it happens so often on the island.
Yeah.
I can't help but ask, how can we maximize oxygen flow to the brain? And I'm only asking this because we are coming off the cusp of COVID-19, right? And COVID-19 is essentially a respiratory illness that affects oxygen flow because it's a blood flow, oxygen, So how can we maximize having blood flow to all our organs, especially our central nervous system, which is the brain?
And it all boils down to lifestyle modification. So eating healthy, right? Because we want to prevent damage to the vessels. And all of those high fat, high sugar foods will end up forming plaques in the vessels. And those are what is weak will break down and cause clot formation, or it will break the vessels. So it starts with our diet and of course exercise. The recommendation is for moderate intensity exercise for at least 150 minutes a week. So that's 30 minutes for at least 5 days a week.
Okay,
I
interesting.
had a feeling exercise
And
would
I
have
used
been
to,
one.
yeah, and I used to exercise every day,
Every day. And what
and
happened, Dwayne?
but you know something, I think I have to change the way I make jokes, because sometimes, you're laughing already, you can't laugh. But anyway,
Okay.
I used to make this joke when my friends skin up their face. I'd be like, "Oh, look at you now, stroke," or
Oh my.
so I need to stop that, because I am now understanding how serious a stroke can be, and in some key instances, and it can be very fatal. How do we prevent? Well, how does your department deal with those fatal or almost fatal stroke instances?
So getting here early is important because we need to determine what type of stroke you have because the treatment for both is different. But the majority of stroke that we see are the ischemic strokes, the clots, right? So our goal, once you reach here on time, is to remove that clot, right? And we only have, as I said, a narrow time frame to get that done. If you come outside of that window, our goal then becomes preserving the area around the area that was infarcted or died, and also to prevent you from having a recurrent stroke. So having one stroke is a risk factor for having another. Yeah, so that's our goal. And also, we're going to manage all of your comorbidities. We're going to bring down that blood pressure. We're going to manage the blood sugar if it's uncontrolled. We're going to treat the cholesterol. And you're going to see all the lovely therapists that we have as they try to help you regain a good life outlook.
Okay. All right. So now a lot of people, you're saying that a lot of people they normally watch the stroke happen. They watch at the signs and the symptoms, and you are stressing on time to get to the hospital. Now, is there anything within that time period between seeing the first symptom of that stroke to getting to the hospital? Is there anything that the person themselves can do within that time to,
Help preserve.
preserve, that part that you're trying to save, or stop the progress of the stroke happening? Is there anything that can be done?
Well, the goal is to get here as fast as possible. Now, some people long ago we used to say take an aspirin, but that's usually if you think you're having a heart attack. But the reason we wouldn't recommend that in a stroke is that we don't know what type of stroke you're having. If you take an aspirin and you have a hemorrhagic stroke, it's going to make the bleeding worse, right? So the goal is to get here as fast as possible, to try to stay as calm as possible, to get someone to bring you the ambulance or a relative. Please don't drive. People do that as well. Do Get someone to bring you to a health facility as early as possible and to stay calm because you don't want anxiety to cause your blood pressure to go even higher.
Interesting.
All right. Okay. And I know you mentioned lifestyle choices, diet and exercise. Is there anything else that could be done to prevent a stroke? Because you're saying that one stroke can lead to another. So within that time, I mean, after you all would have treated with the stroke and everything, is there anything that could be done to prevent another stroke happening, or to prevent a stroke all entirely for the persons who haven't experienced one?
So in addition to that and exercise, smoking cessation, you need to stop smoking, right? That's a given. Limiting the amount of alcohol that you consume. So a normal intake of alcohol for a woman would be one drink, one standard drink, and a male, two standard drink. But obviously, please try not to drink every day, right? Because that will, purport other problems for you. And then, of course, working with your healthcare team to manage your medical conditions, even if you're well, getting your wellness checks at least twice a year to ensure that, these conditions are not occurring. Because as I said before, hypertension is a silent killer. You wouldn't know you have it unless you check for it.
Yeah.
Okay. There is one myth I want her to debunk before we
There
leave
may be
here.
others as well.
A few, but there is just this one that stands out. Now, I know you told me that you were going to deal with the hemorrhagic and ischemic strokes this morning, but in
Yes.
terms of the heat stroke, when I come out of the sun and I want to go to the fridge to get a drink, would that be a problem, going from very hot to very cold?
No, you want to get me in trouble with your grandparents. Right? So Usually we try not to go from extreme hot to extreme cold. And the reason for that is as you go into the cold areas, your blood vessels will constrict. So some people with the change in environments, you can feel dizzy, you can black out, right? And that is a problem by itself. But try to not do that. It is not a cause of stroke, right? But it can cause you to have symptoms such as loss of consciousness, dizziness, and you don't want to fall and hit your head. If you're having a heat stroke, so those persons who are jumping up in carnival or marching in a parade and they're in the sun for a long time and they black out, you need to get them to a cool environment, cool them down a bit, ice packs under the arms, a cool rag on the head, let them lie flat on their back, or you can elevate their legs, right? And as soon as they are awake, then let them drink fluids as much as possible.
Okay, and the same idea comes from if you are ironing your clothes and you should cool down before you go and take a bath. Yeah, it's the same thing.
It would not cause a stroke, but it can't. But it depends on how hot you are to go into how cold you are. It's the constriction. That cold water is going to cause those vessels to constrict and will prevent blood from getting to where it needs to go.
I feel like I can look forward to I told you so from my mother when I get home, because I know she's watching this.
Yeah. No war. We're not trying to ensue any war here. But my final question to you is, Doctor, what are some local bush medicine you could use? No, I've heard, I don't know if you might know, that brewing some marijuana leaves, right, can maximize blood flow and oxygen flow to the brain. In your humble view or research, is there any merit to that idea? If not, can you recommend any other bush, as we could say, to help with that? We Tobagonians like we bush everything.
Yeah, we know. The osteopathic medicine is actually a known branch of medicine. So I can't really speak to the herbs. They are more likely to be able to tell you the herbs, the dosage, etc., what to take. As a physician, I have to discuss the drugs that we use that are approved by the
Pharmaceutical
FDA.
drugs, yes.
There's a lot of research into marijuana and all the benefits of marijuana. So probably look out in the future for good research on that to see the effects on circulation. But I know for a fact that some studies have shown that smoking marijuana, because it can increase your heart rate and can fluctuate your blood pressure, some studies put you at increased risk for stroke. But then again, it depends on the formulation, what it's mixed with, etc. So the studies coming out of that will give us more information in the future. So hopefully more people do studies on marijuana, or specifically THC.
Yes.
Okay. Yeah.
Guys, do not smoke marijuana.
All entirely. Just leave marijuana alone.
Don't smoke at all. The leaves, you could drink it, in Jesus' name.
All right. Dr. Edebo, thank you so much for joining us this morning. We appreciate you being here, getting this information firsthand to our viewers that may not have known. Now you know, right? Tobago Updates is here to update you on everything you need to know, right? So Dr. Edebo, thank you so much for being with us here this morning. Viewers, as we continue on, we encourage you to share the live, share the live, share the live. We'll be right back.